Hello everyone, I am Dr. Manjiri. I am a consultant IVF specialist at Bhide Hospital Test Tube Baby Center in Navi Peth, Pune. Today, let us talk about endometriosis. Endometriosis is a very dreaded disease which is one of the major causes for infertility these days, and we need to discuss about what are the causes of endometriosis or what are the implications of endometriosis on fertility of women. Now, as we know, during the normal menstrual cycle, the blood flows from the uterus to the vagina outside the body. There are certain unfortunate women in whom there is a reverse flow of the menstrual blood from the uterus back to the fallopian tube and sometimes to the ovary, and there is collection and deposit of this menstrual blood in the reproductive system, causing certain big cysts in the ovaries which are known as endometriomas, or sometimes it goes right into the wall of the uterus and causes adenomyosis or adenomyomas. Now, how can we know whether a patient has endometriosis? Frankly speaking, there are no clear signs and symptoms of endometriosis, but whenever a patient comes to us complaining of severe pain during her menstrual cycle or heavy menstrual bleeding, or at times pain during sexual intercourse or pain while passing urine or passing stools, that is when we suspect a patient having endometriosis. Unfortunately, the sonography doesn't diagnose endometriosis per se, and the gold standard for diagnosis is a diagnostic surgery which is known as laparoscopy. Now, whenever we perform laparoscopy for any patient who cannot conceive because of endometriosis, or in a patient whom we are suspecting endometriosis, we many times come across endometriotic cyst which needs removal in the same seating, or sometimes the uterus is really stuck to the bladder, bowel, and adhesiolysis or removing all these adhesions is very important to make way for the egg to develop and for the egg to rupture. So in these patients, because of endometriosis, the egg quality is poor at times, and we grade these patients as mild endometriosis or severe endometriosis. Now, in mild varieties of endometriosis, which is grade 1 and 2, generally a simpler form of treatments like intrauterine inseminations or IUIs can work. However, in grade 3 and 4 endometriosis, advanced technological treatments like test tube baby technology, which may be IVF or ICSI, may be required to harbor a child. So, if you are having the above symptoms, please be aware of endometriosis, consult your fertility specialist, and take further treatments to be able to have a child as quickly as possible. Thank you.